Hi, David, are you online? I just wanted to check. Okay. Hi, everyone. This is Anne-Marie from the Campaign Against Racism. I'm not sure if David is on or he's having trouble with the internet in Haiti. So I thought we could get started with intros and maybe he'll join and facilitate the call. So I can start. Hi, everyone. This is Anne-Marie and I'm calling from Barcelona and I'm the community organizer for the Campaign Against Racism. And I'll pass it to Claire, who I saw is online.
Hello, can you hear me?
Yes, we can.
Hi, this is Claire from the Atlanta chapter. What are we doing with introductions, Anne-Marie?
Yeah, Claire, we're just saying the place we're from.
Okay.
And then on the scale of -10 to 10, how we're feeling in terms of like 0 being balanced. And the higher up on the scale we go, more nervous energy, and the lower, obviously, some low energy.
Okay, I would say I'm about a 0 right now. Okay, and I will pass it to Brendan Johnson.
Hi, everyone. My name is Brendan, and I'm a medical student at University of Minnesota and a student at Duke Divinity School right now as well. And I'm feeling about a -2. But I did get some good news today that my friend just got out of the ICU, so that's great. And I will pass it to Renan.
Are you there, Renan? I think your microphone's muted.
Hi. Hello. Sorry about that. No. So I'm Renan, Ishmael, and Daniel will join us in a little bit. We're from the Campaign Against Racism in Las Cruces, the chapter in Las Cruces, and we're looking forward to talking in a little bit about immigration and what's going on at the border and what our chapter is doing here to address the crisis. I guess I'm at a 2 on the scale. About a 3-ish on the scale. It's gonna be a nice day. Yeah. Cool. And we're gonna pass it on to let's see, who should we pass it on to right now? Pick somebody. Rowena. I'm gonna pass it on to Rowena.
Oh, hi. This is Rowena. I'm a medical student at Touro University in California. And I would say that on the scale, I'm a 2 right now. And I'll go ahead and pass it on to Leanne.
Hi everyone, glad to be here. My name is Leanne. I'm a public health student at Johns Hopkins in Baltimore and former social fellow in social medicine. I put myself at a, let's say, 3 today, and I'll pass it to my girl, Peru.
Oh, I'm happy, Leanne. Hi everyone, Peru Nabire from Uganda. I'm on the Campaign Against Racism Ugandan chapter, and I'm the illustrator for the campaign. So I'm happy to be, on this group. Maybe I'm from other thing is I'm a student of Makerere University. So yes, I'm happy to be on a scale of 1 to 10. I think I'm around 5, and I'm leaving the 5 to looking forward to narrative medicine in this session. So thank you. I pass it on to Lenan Orella. I think, I don't know if I'm the last one, but I'll pass it on to them.
Yeah, we already went. We already went. Yes. We'll pass it on to someone, to Paul Ranelli.
Hello there. I'm just trying to, I don't think I have a camera. You can hear me, I know. I'm using a loaner computer today. Mine's in the shop. So I'm Paul Ranelli. I'm a professor of pharmacy, social pharmacy at the University of Minnesota. And I work with the arts, different levels of art education in health science education, theater and visual arts, and training students using those techniques. And I'm about 8 today. So I'm not sure how many are left. Francis, have you gone?
Not yet. Hi, my name is Francis. I'm calling from Oakland, California. I work with the UC San Francisco HEAL Initiative. We're a 2-year global health fellowship that's centered on social justice, health equity, and radical transformation. And we work with frontline health workers from 9 different countries across 19 different partner sites. And today I'm feeling kind of low energy, maybe a 3 or 4. And I'll pass it on to Kyle. Have you gone yet?
No, I have not. Can you hear me? Yeah?
Yes.
Okay. I'm Kyle Mistretta. I'm a public health and medical student from LSU New Orleans. This is my first time joining that I heard from a friend. So I'm excited to see everything about the group and whatnot. And I rate myself as a 5 today. So thank you all for having me. And I'm not sure who hasn't gone. Has Claire gone? I'm not sure.
Yeah, I've gone.
Oh, okay, I'm sorry. I'm not sure.
We can just ask people to start jumping in now for the last 5 minutes of intros.
Hi, my name is Swati.
I think Leah Swift, were you trying to jump in first? Do you want to go ahead and then we'll continue?
Oh no, oh shoot, I am on audio. Hi all. Ouch. See if I can get some video up. Alrighty. My name is Leah Swift. I'm a pediatrician. I'm a faculty member at the Burrell College of Osteopathic Medicine, and I work with the inspiring students of the last Cruces chapter of the Campaign Against Racism. This is my first time joining this call. I'm happy to be here.
Hey, this is Virginia. I'm a PEDS resident at Tulane in New Orleans. Hi, Kyle. I'm with the New Orleans chapter of the CAR, and I probably won't be able to be on here for very long because I'm in the middle of, I'm in the ICU right now, just calling in to listen while I wait for rounds. And I'm sick right now, so I'm lower. I don't remember what the scale is, but lower on the scale today, definitely.
Can you hear me? This is my first time. Yes. My name is Scott. I currently do medical anthropology at the University of Cambridge in the UK, but I do medicine at the University of Texas in Austin. And I'm actually originally from El Paso and study immigration, so I was very interested in this call. Thank you.
Anyone else that hasn't had the chance to introduce themselves?
My name is Swati Abashia, and I'm an associate professor at the University of Texas at Austin Dell Medical School. And I've been following the emails for the social medicine calls, but this is the first one I'm on because I happen to finally have administrative time when you guys are having a call.
Great, it's great that we have so many new people also joining, or the first time that have been following the Social Medicine Consortium. Anyone else?
Hi everyone, I'm Badge. I'm a doctor who works in remote northern communities in Canada. I join SMC calls from time to time.
Great. Okay, so as I said, I don't usually run the SMC calls. David usually runs them, but I think he's had some problems of internet from Haiti, I heard. So the SMC invited us, both myself as the organizer for the campaign against racism, and then everyone who is involved in Las Cruces chapter on the call, just to try and start to give some updates about what the campaign's been doing. In particular now, because we're kind of a year and a half in. So I think for sure we're strengthening our organising. I think we're being more disruptive with our tactics, and we're really excited to just have this space to share it with you. And I just want to let you all know that we always have this call right now for the SMC, and then directly after we have a campaign-wide call as well, where we invite 23 of our chapters to kind of join. And every month we kind of touch either upon our racial capitalism praxis or upon our organising praxis. So I think to begin with, I'll just give 5 minutes of like where we're at with the campaign. I know some people are familiar, even some people are part of the campaign. And then I think there's obviously new people joining, so I just want to make sure we're on the same level. So I guess very briefly, the campaign against racism started 1.5 years, almost I think now 2 years ago, when Camera Jones from the American Public Health Association initially launched the campaign against racism within the US, and then asked that the Social Medicine Consortium take on the global part of the campaign against racism, given their existing global network that was already ongoing, with so many health professionals kind of interested in social medicine. So that happened like 2 years ago, where we started to take it on, and I think we started to move away more from educational activities, which the Social Medicine Consortium continues to do. And I think the campaign against racism tries to really radically elevate the chapters via organising and via health justice. So a year ago, we started doing that around the strategic objective of the campaign, which was to dismantle, I guess, to firstly name structural racism, which obviously people know in various contexts is a struggle in itself, and then to create goals that dismantle structural racism. So last year we kind of had like, I think 25 contexts that worked on that. And then in September, we started the second phase of the campaign, which was, that actually started when we were at the SMC conference in Chiapas, where we really started to think about structural racism and the economic system behind structural racism, which is obviously capitalism. And we started to think, what would it look like if within our organising, we not only started to talk about structural racism, but started to think about the economic kind of benefits also of maintaining this system of oppression. So this year we've been trying to collectively study both systems of oppression and think about how that's intersecting in various contexts. And that's where we are. We now have 23 contexts that have strategic goals based on racial capitalism. You can go on the Social Medicine website and you'll see the campaign against racism, and you'll see a map with 23 places, which we just updated. And if you see a place that like you're interested in that's near you and you want to like drop in the next chapter meeting, we're very open to kind of have more bandwidth obviously on the ground, and we're very open to obviously having more health professionals that want to learn about organising as well. And I kind of think apart from racial capitalism and a lot of collective studying and political education we're doing around that, Kind of priorities of the campaign right now are to strengthen our coaching structure, which is this kind of mentor structure that each chapter has this person that kind of troubleshoots and accompanies them in the organising path. And we're just making sure that those coaches are prepared to do that with each chapter and have the contextual knowledge that the chapters need and feel supported. And then another thing that we're doing right now, which I think is very relevant to SMC people, is we are building out our advisory board for the campaign against racism. And we're really putting out a special call for anyone who has contacts on organising, on racial capitalism, on anything that kind of is discussed in what the chapters are doing. To be honest, particularly with the US, because I think with Camera Jones, etc., our network is strong in the US, but we're still trying to build a global network and therefore want more global advisors on the board. So I'll pause there. I'll say also myself, I am involved in the Barcelona chapter for the campaign against racism. And I think it's interesting for this call because we also work in the situation of migration. We work more obviously in the context of the European migrant crisis. And in Barcelona in particular, we work with the context of unaccompanied minors or undocumented migrants that are mostly around the age of 18 or 19 that tend to be the most invisible population in the migrant crisis, particularly obviously women and girls for us in Barcelona. And we are organising around trying to name the policies, the racial capitalism policies that we feel try and keep those unaccompanied minors and young migrants in their situation of oppression. Yeah, so I'll pause there and maybe open up for questions, and then we'll move straight to Las Cruces chapter. So any question on the campaign in general, the work in Barcelona, the organising praxis, the new praxis of capitalism? And also I can see like Yuri, Virginia, the Las Cruces chapter, jump in and let me know if there's anything I'm missing that you feel that we should.
I have a question. I'm looking for the website for Campaign Against Racism. Is there a set website or is it based on chapter?
I can drop that link right in now because I opened it up. Thanks for reminding me. So it's within the social medicine and then consortium website, and then we have our own separate part for the campaign against racism.
Thank you.
And if you click on the map, if you click on the place, for example, Las Cruces or Barcelona or Haiti, you can see the chapter representative and you can see the strategic goal. Any other questions or comments on the campaign? All right, then we will move to give the floor to Las Cruces.
Hey everyone. Hello everyone. Again, I'm Ismail. This is Renan. And that's Diana. And we're at Las Cruces. So I guess today we're going to be talking to you about, what we've been trying to get done in Las Cruces and how we've been trying to fight the, capitalist racial system that we have at the southern New Mexico border. So I guess the very first thing we need to do is to give you a complete picture of the issues we're facing, and then then we'll get into how we're addressing those issues and strategies we've developed to address those issues. So first things first is we mainly do our work at the Immigration Detention Center. And the one thing you need to know about the Immigration Detention Center is it's supposed to be a form of civil detention. And that's very important because a lot of times when you see people incarcerated, they've committed a crime. However, people who are trying to get into the United States, who are being detained at the border, at the immigration enforcement detention centers, have not committed a crime. They're there, it's a form of civil detention, and they're there to make sure that they're able to show up to their court dates, they're able to see the judge, and they're able to progress with their processing to become, so in the fight for, let's say, asylum, refugee status, or citizenship. However, because they're not being incarcerated by the law, they're also not afforded a lot of the civil liberties that a normal American citizen who is incarcerated by the law would have. So, for instance, people who are detained at the border are not given that free phone call everyone knows about. If you watch any movies, where's my free phone call? You don't get that. You have to pay for that. You're not assigned an attorney. You have to pay for an attorney if you want one. And a lot of times people are coming in from different countries and don't understand English, or English is not their first language, or they don't speak English, and they have to face the judge and they have to go to court without really understanding what's going on around them. So that's important to know. Another very good thing about, not good thing, but another thing about not having the same liberties that an incarcerated person would have is they're not afforded a speedy trial. So there isn't a time limit on how long they can be held. So once you get into the immigration detention center, you're essentially held for as long as it takes to before your case is cleared. And it's a really psychologically negative effect on people because you just don't know. You're just sitting in there, you're just sitting in the cell, and for as long as it takes, you're not really given information about where your case is. You don't have access to information. You're being treated like a prisoner because the same companies who run a lot of prisons in the United States, the same private companies, are also the ones that run the immigration detention center. So it's a very negative experience, a very traumatizing experience for a lot of people. So that's a very brief overview of what immigration is and how it's sort of been performed here. But there's also an historical context to immigration detention in the United States. So, well, if we go back to the 1850s and all, we learned recently that Ellis Island was one of the very first places that immigration detention was created. And it's done in such a way that you are on United States soil, but you're still not given those same civil liberties. And as the years, and recently, a lot of the little liberties that people have been progressively taken away from them. For instance, in 2006, we had a congressman called David Byrd who signed into law that at least 30,000 people need to be in immigration in ICE custody at a time. So, before 2006, if you look at the numbers, there was just underneath 20,000 people in immigration detention. And then after 2006, it went up to above 30,000. Right now, we're approaching about 50,000 people detained. Total in a year, we have almost 300,000 to 400,000 people being detained. And it is the prerogative of ICE, which is the Immigration Enforcement, Immigration and Customs Enforcement, to keep people detained, how they receive their funding. And very important historical context to know about this is Robert Byrd used to be a former KKK member. In his 20s and 30s, he recruited for the KKK. Even after becoming a congressman, he spoke positively about the KKK, Ku Klux Klan. So having his sort of fingerprint on the immigration policy that's being practiced at the New Mexico, the southern New Mexico border is just negative. Not being done in a way that's fair to a lot of people of color and a lot of people that come from other countries like Latin American countries. It's very done in such a way that it's supposed to penalize them for wanting better lives or wanting to come into the United States. And so that's what we found out. but also the ICE department, and ICE department is underneath the Department of Homeland Security. The Department of Homeland Security itself has published reports about how negatively or how bad the process of getting seeking asylum or going from a detainee to becoming a U.S. citizen is on people who go through that process, how traumatic that process is. You know, they themselves have reported the use of solitary confinement as some form of punishment. And again, this is supposed to be a civil detention. It's not supposed to be punishment, but yeah, there's a lot of solitary confinement being practiced at these detention centers. It's gotten to a point now where if you're sick, that's the one thing we know. If you're sick and if you're badly hurt, instead of being taken care of, you just thrown into solitary confinement. You know, there's a lot of staff mistreatment. One of the companies that runs the closest immigration center to us is the Otero Immigration Department, and it's run by Management and Training Corporation. And when immigrants first get there, upon entering there, the guards will tell them, "Welcome to the Mental and Torture Center." That's a play on the Management and Training Corporation, MTC. So they say, "Oh, welcome to the Mental and Torture Center." So it's being done intentionally, and it's not supposed to be that way. We've also heard about a lot of medical neglect going on at these detention centers and at the border. And medical neglect is one of it is the leading cause of, you know, problems and the leading cause of death at the detention center. And as of 2019, we heard of about 200 people who've passed and who've died in ICE custody. And this is actually an understatement, I should say. It's not the real number, because the number is greater than 200. And the immigration and customs enforcement goes through different types of loops and holes, and they work around different laws so they don't have to report some certain debts. One thing they definitely do, and we do know of, is normally if a detainee is sick or ill, they don't take care of those detainees, so they throw them in solitary confinement, which further worsens their condition. And right at the point where the person is about to pass, they release that person from ICE custody. So now that person is released and no longer under ICE custody. And when that person passes, they don't have to add it to their list of, you know, they don't have to add it to the numbers of people who've passed in their custody. You know, we've seen that. We saw that last year with a transgender woman who went through the same thing. She was immediately released and then she passed. Just early this year, about 2 months ago, right? We saw something similar with an Angolan detainee who had a sigmoid voidless, and that's when your intestine kind of twists on itself. It's a very painful process. And the fact that you got that badge and the amount of pain that person was under as that person was passing, you know, it's unimaginable. And reports like that, and those are the ones we heard about, you know. So that's sort of the situation, you know, in a nutshell. You know, there are other reports that come out about sexual harassment, you know, physical assault, but it's a really bad and detrimental situation. And, you know, we're just trying our best to sort of bring light to the issue and try to let other people know what's going on here. And I think there's also this huge misconception, especially with the new administration in power now, that a lot of detainees are from Mexico, or a lot of detainees are gang members from Mexico. And this is so far from the truth. It's a lie, plain and simple. A lot of people we see are from Latin America. You know, we have some people from Cuba, Honduras, Guatemala. We also have people from as far as Haiti, Nigeria. I recently saw someone this past week who's from Bangladesh. So it's people from all over, you know, and people just looking for better lives for themselves. And these are not just all old men or adults, you know. There are children here, there are women here, there are families, you know, there are teenagers, there are adolescents here. all on a spectrum. This is sort of the situation that people are being subjected to. So I'll pass it on to Renan and Danya to just talk more about the strategies that we're trying to implement at the border.
Yeah, so in general, so that's the rundown of the background, the structural and historical background of what is going on here at the US-Mexico border. So what are we trying to do as a chapter? We're trying to implement the principles of narrative medicine, which for those who aren't familiar with narrative medicine, it's also known as narrative-based medicine. So the one that is typically taught at medical schools is evidence-based medicine. So it's science, the biomedical aspects of it, but we're trying to implement something called narrative medicine, which is a way of honoring each other's stories, a way of not only, so we're using narrative medicine as a way of reporting and calling out the medical negligence happening at these ICE detention centers. Narrative medicine, like I said, is like a way of honoring each other's stories, because if for many of us who are medical students, we're taught basic things like cultural competence, and there's pretty much we're given a way of doing a checklist on a patient's state, right? Like how is a patient doing and all that stuff. But narrative medicine is a way of supplementing evidence-based medicine. And so what we do is pretty much we're telling the stories of all the migrants in detention that we encounter. We're trying to tell the stories of asylum seekers and migrants on the other side of the border as well. So we're using that as a way of calling out the racism and kind of telling their stories. So we're learning along the way. We're not journalists, and like so typical training in narrative medicine is a lot of you're thinking yourself as a journalist, and so there's certain guidelines and principles that are fundamental to it.
It's weird.
But as medical professionals, we're trying to incorporate that into our practice. We're in, like, for those of you who are going into the wards or who are practicing medicine in any way, there's ways of adapting narrative medicine, the principles of narrative medicine in clinical practice. And that's something that we're trying to teach other medical students and to implement as a way of calling out the medical negligence going on in the ICE detention centers. So pretty much we're establishing a community of practice at Burrell College of Osteopathic Medicine where we're at Las Cruces.
Yeah, go ahead.
And we're not trying to be extractive. We're trying to let the patients lead the conversation and to better understand, so that we can better understand what's going on there, but without, making it a matter of voyeurism or like, oh, we're using it as a way of better understanding and being better able to call it out. So we're trying to develop reports on the medical negligence. There's been instances of miscarriages in detention.
I think just tell me that word with data you got, and you can write that in. That
as Ishmael said, there's a man who died of a sigmoid volvulus, and while that happened in ICE detention.
You just document that, because really, what you're talking about too is like, here's where I need to get information.
Sorry, Renan, it's just.
So you just use it as that. I think that's.
Excuse me, just sorry, Toby Smith. You're not muted. Sorry, and we can't hear. Perfect.
Sorry, I am now.
It's okay. Thanks, Renan. Continue.
Okay, so so these stories of people dying under ICE custody, people getting sick and being quarantined, people getting receiving pills that they're not familiar with. What we've come across instances of mass sedation in ICE detention, in these detention centers, where people are given random pills they're given tramadol and they don't know what they are. They don't know how to identify the pills. So we're trying to report on these things using narrative medicine as a way of supplementing not only our training as medical students in evidence-based medicine and in biomedicine and all those aspects, but we're trying to really allow people in detention to tell their stories, and it becomes therapeutic. Like Ishmael was saying, they are put in quarantine, they're put in solitary confinement, they don't have access to the same civil liberties that one could say like prisoners in other detention centers that are not immigration related. They're not afforded those civil liberties, so they become very lonely. There's like the ones that I have talked to have mentioned how depressed they are, so that's another issue that we're also coming across, mental health. So alongside the mass sedation, the mental health issues, the death under ICE custody, we're trying to really document all of this. We're looking at medical records of some of the detainees. So we're looking at death reports, because all of this is going under the radar of the general population, because ICE is able to hide it. ICE is able to be like, they didn't die under our custody, so they died at a hospital, so we don't have to report this death. So ultimately, that's our work. So we're trying to really disrupt in a very, in a way that we can, the current, I guess the current narrative on immigration at the societal level and at the political level, and by really calling out this medical negligence and like really calling out these human rights violations that are happening in detention. And but we're kind of like, it's one of those things where we're developing relationships with migrants and detained migrants in particular, and helping, and pretty much we co-create, you could say, we co-create the trajectory of this patient's narrative. We try to really like bring together all that's going on in their lives and help them understand it, while helping us understand what's going on so that we could call it out as well, so that immigrant detention can no longer be a thing. So we're trying to abolish, we're trying to help abolish it, where we can't do much as medical students, but we're trying to end detention, immigrant detention, and these human rights violations by really shedding light on what's going on. And we're using narrative medicine, the principles of narrative medicine, to do so. So in the future, we're trying to hold a series of narrative medicine trainings. We'll be sharing this more widely, I guess, with the Social Medicine Consortium alongside the Campaign Against Racism, because it's a fundamental tool in the patient interview that is often neglected, how to interact and how to become a co-creator in the narrative of a patient. So it's important that we become familiar with it as healthcare providers. So anyone can join us. I think we had one with Michelle Morris recently, and it was fantastic. We learned a lot. We're having a few more in the future. So join us and really understand how you could supplement your clinical practice with this very useful tool to engage with your patients better and to better understand and provide better healthcare, as well as really bring light to things that are going on in the system, and really start to dismantle these structural and historical offenses against very vulnerable populations and marginalized groups. So I'm going to hand it off to Danya to give a summary of what we're doing, and for anyone who wants to get involved as well, we would really appreciate that. And we're lucky to have also Dr. Leah Swift, who's on the call as well, and she's been fundamental to our progress, here. And she's a pediatrician here and a faculty member at our medical school. So she's been great support for us. So as we move forward, any support we could get in any way is great. So in terms of our initiatives and activities, I'll hand it over to Dan.
So as of right now, one of the biggest problems we're noticing within the MPCs and the camps over here with the asylum seekers, and especially with our work with AFID, which is the group that's been providing lawyer services and really looking into and investigating the crimes that are happening against asylum seekers, is that there wasn't really much professional medical advice when it came to these situations, right? So AVID is mainly a group made out of lawyers. They have a lawyer training rather than medical, of course. And so we found, through them that it's been hard to be able to document the certain atrocities that have been happening, or like for example, these asylum seekers are being given medications that they just don't know what they're for. Mass sedation basically is what we figured out what was happening. And it hasn't very much been documented in the Las Cruces, El Paso region. So me and Dr. Swift, we've recently been in contact with physicians for human rights, and surprisingly, there isn't really a chapter down here that can look into these sort of situations, because again, we're medical students. We aren't really qualified to give medical advice or give medical treatment. We're in the process of learning how to do so. So it's kind of mitigated, I think, a little bit of our efforts at the camps here, just because it's been very hard to be able to take that information and kind of throw it into something that's very substantial and that could be recognized by medical professionals. So we are in the works of getting an organization set up here, another branch of the Physicians for Human Rights. We know there is one up in Albuquerque, and we do know that they work currently with a lot of the border issues that are going on right now. We just don't have anything particular to Las Cruces and El Paso. So that's been on the come up, and we're in the process of recruiting physicians, and hopefully within the next few months, we could get a training done up in Albuquerque. So then, and the hopes, the goal of having that set up is that when there does need to be a medical professional for the situations where someone needs to come in and, evaluate, triage these asylum seekers, we would be able to do so without much difficulty. So that's one thing that I've been working personally with Dr. Swift on. A couple of other things that we've been working on in general, we do have the visitations to the detention centers. Ish and Renan have been mostly involved with that, but again, it's the idea of using narrative medicine and implementing that there in the hopes that there could be some sort of therapeutic process to these terrible situations that the asylum seekers find themselves in. And then the other thing that we're working on right now is that we are starting visitations to Puntos Guamas with Dr. Mary Alice, and she's one of the anthro professors here at NMSU, and she does a lot of work with the family medical rotations here. She does a lot of work in northern New Mexico in the Juarez area, and basically, again, the idea of implementing narrative medicine in a region where there's very little resources for the patients that are over there who are currently being treated for cancer. And then, am I forgetting anything? Because you had a lot, yeah. Okay.
Yeah, I think overall, that's what our chapter is doing in a nutshell, and we're using this to really report on the medical negligence that's going on and to really call out things to the best of our abilities, but using patients' narratives to really guide the conversation and not being us in our voyeuristic, kind of like, oh, we're trying to like dismantle something. No, we're trying to really highlight the suffering of people at the systemic level and really be like, this is not right. And as future medical professionals, we really want to have the capacity to continue doing so and training other medical students to do so and training other healthcare professionals to really not allow these things. There are medical professionals in El Paso who are complicit with these human rights violations. There's people getting like hunger strikers getting nasogastric tubes stuffed in like that are larger than what is typically used in hospital settings. They're just getting them stuffed down so to force feed them pretty much. So we're engaging not only with future healthcare providers, but really calling out the human rights violations that current medical providers are performing in terms of mass sedation, in terms of force feeding of hunger strikers. So pretty much that's what it is. We're trying to use narrative medicine to address the border crisis happening at the US-Mexico border. And any support we can get from anyone is always welcome. It's a complicated situation, and we have a good number of students in our chapter. We've really grown significantly, so we're able to really use distributive leadership to engage them in all these different aspects of our campaign. But now we want to open up for any questions, any comments before we close out, I guess.
Hi, this is Leah Swift. I want to shout out to all these 3 students who put in a tremendous amount of hard work and passion. I also want to ask if there are any, in particular, I'd be interested in connecting with any pharmacists or anybody involved in pharmacy through this group. As we start to look at the prescription medication or overprescribing of sedatives to those in detention, I'm particularly interested in whether or not we can submit a FOIA request to ICE detention in order to obtain more information about how many of these prescriptions. Hey, my poor child. She always seems to cry on these calls. No. Whether or not what the legal ramifications are of using sedatives in detention. Thanks.
Let's go. Can we go back? Are we on mute?
Yeah, we're not.
We're not muted? Okay. I think what Dr. Swift was trying to say is, as we've been sort of exploring the idea of how to go after immigration detention, we have been seeing a lot of consistent, a consistent pattern of people, just showing up to a medical bay every single day, and you're handed the pill, and you take the pill, and that's it. You're not being told what you're taking. There isn't a translator there that's providing you, sort of a description of what this pill is supposed to do to you. All we know is people take the pill and they feel sleepy after. And that's the extent of it. And some of these people who are taking these pills, they don't have any medical condition that justifies a reason for them to be taking the pill to begin with. So it seems very unusual, and it seems it's been done on a very large scale. So what we're trying to do now is just sort of connect with pharmacists and connect with other medical professionals that can give us better ideas that could help us strategize as to how to go after this problem. Because, as we go through this, we're trying to use narrative medicine, and through narrative medicine, we're able to talk to people, we're able to talk to people and get an idea of what's going on at the centers. But I think now it's coming to a point where we need to go beyond ourselves and begin strategizing with as many people as we can from different top contexts and different perspectives to be able to get a better idea of, how to go after this and, how to really sort of plan stepwise to go after this issue. Yeah.
So I'm going to provide my email address for anyone who has any connections with any physicians in the El Paso, Las Cruces area, or any pharmacists as well. We're particularly looking for any professionals in pharmacology or any pharmacists who could provide support as we're doing this. So I provided my contact information. If there are any connections, we'd love any help we could get, even if remotely. It's fundamental that we start to address this issue of mass sedation, of inappropriate medical management of patients and asylum seekers. So any connections with physicians in the area, pharmacists, remotely, even if we have to have a better understanding of how this is really just not supposed to be, how ICE is circumventing basic medical principles.
This is Paul Ranelli. I'm in the College of Pharmacy at Minnesota. Your University of New Mexico certainly has a pharmacy school, and I don't know if you're connected with anybody there.
Not currently. It would be very good to connect with someone.
And there's a program in New Mexico called, they have emphasized, it's now nationwide, but they originally got started about opioid abuse and opioid prescribing, and it's called ECHO, E-C-H-O. And there may be some, it stands for something that escapes me at the moment. Education something. It's a rural education network of physicians, pharmacists, and nurses that they do a lot of tele-education among themselves. As I said, it focused in on opioids, but they're expanding to other issues. And so I got your email through the chat. I'll probably send some connections to you about that.
Fantastic. Thank you so much. That'd be very helpful.
You're welcome.
So if there are any questions or comments, hello.
Hi, hey guys. I wanted to say first, I'm so happy about you guys sharing your experience and the work that you're doing with us. I really appreciated this call and all the work that you guys are doing. So I had a couple of comments and questions. The first one is, how do we get in touch with you about doing a narrative medicine workshop? Because I'm a part of the Atlanta chapter, and we are doing works kind of similar to what you guys are doing. We go and visit people who are incarcerated, and one of the facilities we go to is an ICE detention facility. So we want to kind of incorporate narrative medicine more into our visits, and having kind of a more structured way of collecting the stories that we're hearing and sharing them to the broader medical community. So I'm curious how we can get in contact with you guys about workshops.
Yeah, definitely. So we're putting on a series of narrative medicine trainings, and you guys are welcome to hop on. They're usually webinars because they're remote. The people who are facilitating these workshops are in other places, so it'd be great if you guys hopped on or kind of helped organize these, and we could just continue this, this process of learning narrative, because we don't know much about it either, and there's certain aspects of it that aren't necessarily part of what we're trained as medical students or as physicians or residents. So we'll be in touch. I think that'd be great.
Okay, awesome. I'll get in touch with you guys via email.
Perfect.
And then one of the next questions I had is, so once you collect these stories and you're basically bearing witness to people suffering, how are you sharing them amongst your colleagues and the wider medical community, or just the public in general?
So right now it's a matter of collecting the stories, and then later on, as we develop a broader base of these stories, we'll start to really use it as data collection, so we can make reports on the medical negligence that's happening. So that's one of the things we're trying to figure out, how exactly we're going to use these stories to really call out what's going on, and make it something purposeful for the medical profession, where it's very data-driven, evidence-based. So that's where the intersection of evidence-based medicine and narrative-based medicine comes into play. We got to figure out exactly how that's going to work.
So as of right now, a lot of the narratives that we are getting from the asylum seekers are being shared strictly within the average group and within us three. And also some of the first years that we have been working with, who are hoping to, see this forward next year when we're off on rotations. The asylum seekers have also given us permission to share these stories. So this is, because we are working with vulnerable populations, we are working, we are being very due diligent about things that aren't meant to be shared at the discretion of who we are currently seeing in these in the detention centers. We have been very, very careful about that information. We haven't gone yet, as Ish said, to anything, for example, like a medical negligence report or anything that has been out, publicly available. That's something that we are hoping to do in the future. However, there are certain questions in, tactics that we have to go about doing that, just because we do want to really respect the people who have so graciously told us these stories that have led to their current circumstances. So that's a work in process that I think we as a chapter are still trying to figure out, because, it's one thing if you're having a face-to-face conversation with some of the asylum seekers, it's another thing to kind of take those stories of of suffering and to, you know, put that out in the public. So that's something we're still working on. And when we do figure out a way to properly address that, I'll let you know and share.
Gotcha. Thank you guys so much.
Yeah, thank you. I think the next call, the Campaign Against Racism call is up next, so we don't want to take time from them. But thank you guys so much for, you know, hearing us out and allowing us to share. It was a good platform to do so, and any support we could get, any support we could provide others, they'd be great. So thank you all.
Thank you. Yeah, thank you so much, Renan. And everyone, sorry guys, this is Casey. I've been floating in the background for a little while. Would it be okay, hey, Las Cruces chapter folks, would it be okay to share your contact information with the broader SMC listserv when we follow up with this call? Specifically around if folks are interested in getting engaged or supporting a narrative medicine workshop?
That would be fantastic. Yeah, I provided mine, and yeah, we could definitely share it more widely. We'd be very grateful with that, yeah.
That's awesome. And I know, like, from the Boston chapter perspective, I think we'd also be really interested in getting involved in that.
Perfect.
More coming soon. And thank you guys again so much for sharing this work. Really excited.
Thank you guys, yeah, for listening. Great. See you guys.
All right. Have a good one, guys.
Bye.
Have a good one.
Decided to love me,   me.   me   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  me
Anyway, I think almost everyone has come to my inbox, like telling me about Delilah. Everyone actually complains. She's like always negative. She's like always telling people bad stuff. She's like, and she's always online. Like, yena aliwo okobera ebituufu n'ebifu. Yena aliwo okobera this and that. You're not the first person, sweetheart, to come to my inbox. I think like 3 people have come to my inbox, all complaining about her shit. What mukungirani anamusamba obulungi oba ani amubinge bulungi. Otherwise, I even thought she looks like really so nice. Mwana strikes. That's what I kept on thinking, like she strikes.
Hello, is this the right line for the?
Hello? People are listening to what I'm saying. What? I must have noted up the meeting. I'm sorry.
Hello? Nobody's saying anything. They're probably muted, don't know it. Okay. Anyway, Is anyone on the call? I hear nobody on this call.
Today when I called Billy, they were driving back from at Friday. Oh, you better go through, y'all. We're driving back from Austria. Oh shoot! I said, I guess I shouldn't be talking to you guys when you're driving.
Okay.
All right, well,